Hello everyone, this is Chadi Alraies from Heart Trending. Today we're going to talk to you about a few things as a patient who will be undergoing coronary angiogram or what's called left heart cath, what to expect, who will need to have it, and the recovery time. Patient who have what's called coronary artery disease, or if your heart doctor tells you that you have to have what's called angiogram of the heart, that means they found on one of the testing that you require some sort of evaluation for your coronaries. Coronaries are these are the arteries that sit on top of the heart. These are the three main arteries supplying blood to the heart muscle, which is considered the pump that push blood to all your system. So if there's any blockage that affect any of these three arteries, then this will compromise the heart muscle, and most of the time patient will have shortness of breath or chest pain. So how we evaluate these with what's called non-invasive way, or the testing that does not require invasive measures or needles or coming to a procedure suite. Number one, if the patient coming with a complaint of chest pain and shortness of breath, and I'm going to put the link for the other videos how these symptoms are in terms of chest pain and which one indicate heart problem versus other problems, then the doctor will be opted for doing more testing. One of the tests is called echocardiogram or ultrasound of the heart. This is when they put gel on the chest to evaluate the heart muscle, see how the squeeze function is, and also if there is any leaky valve. The second test that's usually ordered is called stress test, and this stress test have multiple formats and come in different types as well. The most common one is when the doctor asks you to walk on a treadmill and they connect you to multiple leads or heart monitor. So the heart doing EKG, that the technician doing EKG as you're walking on a treadmill. The treadmill will go in a certain speed and go faster and in a more steeper way to let you kind of get more exerted and to reach what's called the target heart rate. Once you reach your target heart rate, these tests has to be complemented by other measures, which is called imaging. And the imaging could be either by doing ultrasound before the procedure and after you're finished walking, or what's called nuclear stress test. Nuclear stress test this is when you come to the lab and they inject you with a radio tracer that attach to your heart muscle. So before you exercise, they take a picture of the heart, and then when you're done exercising, they take another picture of the heart. If these two pictures matching each other, means the heart blood supply is intact and there is no problem. If there's a mismatch between these two pictures and there's an area in the heart is not getting enough blood supply when you are at peak exercise or when you finish exercise, then this area is not having enough blood supply. Hence, the doctor will talk to you about next step. If you continue to have chest pain and shortness of breath and this test is abnormal, usually the recommendation is to maximize your medical therapy, give you medication called beta blocker and nitrate, sublingual nitrate, to relieve the symptoms. And if symptoms does not improve, then you have to go or undergo what's called coronary angiogram and left heart cath. And that's what we're talking about today. The heart cath is an invasive procedure, but this does not require any surgical cutting or any general anesthesia. Usually this procedure done under moderate sedation, meaning the nurse and the doctor will administer a cocktail of medication that make you sedated, as well as a painkiller that make you pain-free. And then eventually when you come to the surgical suite, you come on the day of the procedure, expectation to be stopping eating and drinking the night before at midnight, come in the morning. If you are taking blood thinner, you have to stop it 2 days before. And eventually you come to the cath lab and then prepare you by starting an IV, give you a gown, and when you are ready, we take you to the procedure room. In the procedure room, we lay you on a table and there's a camera comes above your chest and head. And then we'll start with the procedure by giving you this cocktail I mentioned earlier that make you sleepy as well as painless. Then we give lidocaine, which is the same medication the dentist does when they administer it for your teeth. We administer it usually in the radial area, which is this artery here and on your wrist. Or if there's difficulty accessing this, we go through the groin. The preferred way to go through the radial artery, and this is because it's less bleeding and more comfortable because the patient will sit up right after procedure. When we are done with numbing this area, we go with a needle and access and start an IV in that area, and then administer a couple of medication to make the blood thin, as well as dilate the artery so we can start to deliver equipment. The medication we give is heparin as well as nitroglycerin, other medication called verapamil. This medication to open the artery of the arm. When we are done with that, we start to advancing the catheters. The catheters are a flimsy tube that are considered like a small spaghetti noodle, very flimsy, goes through that IV and go all the way around the artery, all the way up to the heart, and eventually engage in the three arteries. I think this illustrated earlier, and engage in the three arteries and inject contrast dye in these arteries. The doctor, and if you are awake still, you can see it on the monitor next to you, and you see that if there's any blockage in these arteries. If the angiogram is normal, the procedure will take technically from 10 to 15 minutes from the time you start to be on the table. If everything's okay, then everything will be pulled out, and they give you kind of what's called a rest band or like a tourniquet that sits on the wrist here to avoid any bleeding. Then you'll be transferred back to the holding area. Recovery time will take 2 hours, and eventually you go home same day. It is recommended because we are administering some sedative to you to come with a company, or we arrange for somebody to be transferred coming to the procedure as well as leaving back, and driving is not recommended. Finally, if there is any blockage that we found during that procedure, then the procedure will be extended. If there's 1 or 2 blockage, we'll fix them during that procedure. If there is more, or if the blockage in the critical areas, then the doctor will be talking to you when he is done or she is done about possible open heart surgery. So the finding of this angiogram can be one of the three. Either everything's open and there is no blockage in the artery, or some build-up but nothing significant enough to put a stent in. I will talk about the stent in future videos. 2, there is one blockage that can be fixed with a stent and it's favorable anatomy, then the proceduralists will proceed and do that procedure and put a stent in you. 3, there's too much blockage there, or blockage in the main areas or the main supplier of the heart and the critical areas. At that point, the procedure will stop, take you to the holding area, and then we'll be asking our surgical colleagues to come and talk to you about possible open heart surgery. Again, the procedure, when you're done with the procedure, recovery time is 2 hours, and you usually leave the same day in 2 hours from the procedure. So these are what's called same-day procedures. This is when they are scheduled on the day that works for you and your doctor, and eventually you will be leaving the same day. Usually the doctor at the end of the procedure will come and talk to you and your family or your significant other about the finding and what is the next step. And if there's any new medication has to be prescribed for you, or medication has to be taken away or resumed or restarted. It's recommended that to avoid to do any heavy lifting for 1 week, more than a gallon of milk from the artery, from the hand, using that hand where the catheter went through. Again, a gallon of milk is the limit. And also if you go through the groin, and this is recommended not to have any heavy lifting for a week as well. Nothing can happen, but there is a small chance of opening that artery when you are straining and putting that pressure, and also when you're squeezing on something hard that open that artery and subject you to bleeding. Therefore, we recommend that for at least a week to avoid heavy lifting, as well as using the hand for more than a gallon of milk. At the end of the procedure, you'll get your belongings back, and you get the prescriptions or a discharge packet, and with an appointment to follow up with your heart doctor. Make sure you follow up with your heart doctor as well, and make sure you call the office because it's important to go over the findings. I feel that this is a common issue, especially if you have no company with you. I highly recommend somebody coming with you so at least they understand, because you are under the effect of the sedative. Most of the patients don't absorb everything that we did in the procedure, so I would like to talk to somebody in the family. And if not, usually I come back later when the sedative completely gone, or invite them to come to the office in 2 to 3 days to go over the findings with them, because this is your heart, this is your health, and you have to understand what we found, what we fixed, and what is the plan going forward. I hope you found this video helpful for you and your beloved one. If you have any question about this procedure or any heart procedure, please put it in the comment and we'll address them in the future videos. Thank you for watching. This is Chadi Alraies from Heart Trending.